This is Robert Kraft, and I'm your host on SNN.Network. And joining me right now is Scott Powell. He is the Vice President, Investor Relations of VolitionRx. It's a publicly traded company. The symbol is VNRX on the NYSE American. And you can see Scott doing a presentation at our upcoming virtual event, the Planet MicroCap Showcase Virtual, happening April 20 through 22, 2021. Scott, good to see you. How you doing?
I'm well, Bobby. How are you? Thanks for having me.
Thanks for sticking with me through that long introduction. I appreciate it. That's half the battle here, nowadays.
No, I have to do all the talking.
Exactly. So Scott, last time I had you on here, we published that interview on August 4th, 2020. So let's get an update. What are some of the highlights for the company in the last, I guess, around 6 months here?
Thanks, Bobby. I appreciate that. The most important milestone or achievement since we last spoke was we're now a commercial stage company. So VolitionRx launched our first commercial product at the end of 2020, and that is a blood test to screen for two common cancer types in canines. So this is our first foray into animal health, into the veterinary space. We developed this blood test in collaboration with Texas A&M University's Veterinary College of Medicine, and spent about a year with them running clinical studies. And then about the middle of last year, we had clinical data looking at our test performance in identifying canine lymphoma and hemangiosarcoma, which are two very common cancer types in canines. And we had very good accuracy, 74% detection of canine lymphoma and 89% detection of hemangiosarcoma. The results were so good that Texas A&M really encouraged us to launch this blood test, which we did. It's now for sale exclusively through the GI lab of Texas A&M University on their website. And we're very much looking forward to the continued progress and updating investors on how sales continue to track over the course of 2021. So that's the most important development since then, and happy to speak further about this particular product, pricing, the market opportunity, or happy to go into any of our other clinical programs.
No, I want to stay on that. I quickly just looked to see if you have announced Q1's not out yet, so from what you can tell us, how are we tracking? What are initial sales kind of looking like? What's been the reception so far for some of the tests?
Yeah, we'll announce our Q1 financials shortly, and investors will be able to see how it tracked over January, February, March. We launched, really the first full month of sales was in December, and we had a nice launch in December. Really what we are trying to do, we haven't really aggressively marketed this product just yet. Part of it is because we wanted to do sort of quote unquote a soft launch to make sure that we work out any kinks or any issues with the supply chain first before doing a large national launch where we don't want to launch and then fail because we aren't able to get tests analyzed fast enough, aren't able to produce enough to meet some of the demand. So we're doing quote unquote the soft launch to work out the logistics to make sure that we can meet demand from veterinarians across the United States, that we can get it to them in time, that they can get the sample back to us or to Texas A&M in time, that we can release the results in a timely manner. So working out all those issues, packaging, labeling, et cetera, the supply chain, as I mentioned, and then kind of working out some other issues. For instance, one big issue is how long do canines need to fast before having our blood test? So we're working that out with the vets. And so a number of these issues that we're working out. The reception has been good so far. The vets really struggle currently with a good diagnostic test to rule in or rule out cancer with canines. The vets tell us that they have a really hard time differentiating between cancer, infection, and inflammation because a lot of the symptoms mimic each other. And oftentimes, if your canine is sick, you might bring it to the vet, and the vet, instead of doing a large workup and running all kinds of scans and biopsies, the vet may just look at your canine and say, okay, I think it's this. prescribe some pills for you to put into the dog food when you go home. And then hopefully the drugs that were given to your canine are actually addressing the underlying causal factors, but oftentimes they're not. And oftentimes your canine isn't getting any better. You go back to the vet a second or a third time, and at that point, the vet will often then run more invasive diagnostic tests. So think biopsies of certain parts of the animal, scans, MRIs, CAT scans, X-rays. And this can get very expensive for a canine owner. And most of us in the United States don't have pet insurance. So this is all out-of-pocket costs. And a lot of it is unnecessary screening because they're trying to see if it's infection, inflammation, cancer. So if the vets had a tool like a Volition blood test to run right at the very beginning when the canine presents with symptoms to rule in or rule out cancer, they would then be able to run the definitive diagnostic tests in a more targeted fashion. So it would be a lot more cost effective. They'd have an answer, a definitive answer about whether or not it's cancer faster, be able to begin treatment faster. So the end result being lower cost to the system, lower cost to canine owners, faster treatment of the actual underlying causal factor for the canine, and improved outcomes for canines.
And Scott, how big is this market that we're talking about here? Can you elaborate on that for us?
Sure, Bobby. The veterinary opportunity in the United States is significant. There are approximately 77 million canines in the United States alone, about 20 million canines age 7 and older. And the test could be used in a couple different ways. One would be for symptomatic screening. So the vets tell us that they have a really hard time differentiating between cancer and inflammation and infection. So if this test could be run at the onset of those symptoms to rule in or rule out, would be a really interesting opportunity. Now, as I mentioned, we screen for about 1/3 of all canine cancers. So the vets tell us that these cancers are breed specific. So if you're a German Shepherd, for instance, if your German Shepherd gets cancer, for instance, 99% of the time it's X particular cancer. So our blood test could be used if, let's say you have a German Shepherd, let's say German Shepherds are predisposed to hemangiosarcoma, your German Shepherd is sick, it would be a potential candidate for our blood test on the symptomatic side. And with about 1/3 of all cancers identified through our blood test, 1/3 of 77 million is 20, 25 million is the TAM, total addressable market for symptomatic potentially. And then asymptomatic screening is also really important because right now there really is not a good diagnostic tool to identify cancer in the early stages in canines. Virtually all of canines in this country diagnosed with cancer are symptomatic. Right, and that's we don't have the tools available to us to run routine screens on our canines when they're younger. So unfortunately, when cancer is identified in a canine, it's because your canine is symptomatic, it's sick, and usually if the canine is symptomatic, it's usually a late stage cancer. So the outcomes are not very promising. So if we could position this to screen canines, say at age 7, which is when canines are much more likely to develop cancer while they're still well. If it comes back positive, we could start catching these cancers a lot earlier. That would again reduce costs to the system, reduce costs to both diagnostic and therapeutic costs to the pet owner, and improve and save lives of canines. So these are large markets, and we're really excited about this.
So Scott, with that, where can my audience go and find more information about Volition?
Thanks, Bobby. So a great place is our website, www.volition.com, VOLITION.com. There's some great videos, press releases, some of our scientific publications, a lot of good information on the website for investors. And of course, hopefully all of you will continue to follow our press releases and watch us present and at various conferences, and continue to follow our news flow over the course of 2021 and beyond.
Yeah, listen, if anybody listening to this, you're a follower of Volition. If you have not heard Scott present at an event, you haven't looked hard enough, okay? Like, he's at everything, so Scott, thanks again for joining me today. I really do appreciate it. Good luck, stay safe. I look forward to our next update.
Thank you, Bobby. Appreciate the opportunity. Have a great afternoon.
Thank you, you too.